Welcome to the Total Joint Replacement online class. In this video, we'll cover information that will be helpful to you to make your total joint replacement experience a successful one. We will go over information about planning for your operation, getting ready for your hospital stay, what to expect during and after your operation, going home, and the recovery process. You will need assistance at home for about a week following your operation, so it's important to coordinate with friends or family in advance. It's important to have help at home to reduce the risk of falling and to assist with immediate needs as they arise. Western Missouri Bone and Joint will require you to identify at least one caregiver before your operation as a precaution. It is best to have a bed on the ground floor of your home. If your bed is on the upper level of your house, consider moving it to the ground floor. Consider installing handrails along any stairs on decks, patios, or landings used to access the entrance to your home. This will help prevent a fall. It is important to remove tripping hazards from main walkways at your home. Things like rugs and toys should be removed, and if you have a smaller pet, consider boarding them or having them stay with someone else for a while. Buying extra toiletries and food ahead of time will help minimize the need to go shopping after your operation. It's also helpful to prepare meals in advance. Equip your bathroom with non-slip pads in the shower and grab bars for both the shower and the toilet. Rearrange the area where you will spend most of your day so that items you'll be using are within reach. Try to arrange around an outlet for chargers and for recovery equipment. A small end table nearby will be helpful to hold books, TV remotes, your phone, and any other items you'd like to keep nearby while you're healing. If you get a cut, wound, or scrape on your body, especially on the leg being operated on, please notify the surgeon's office prior to the day of your surgery. There is a risk of infection spreading to your new joint from any cut, wound, or scrape, and the surgeon may want to delay your operation. No wound is too small to report. Prior to your operation, you will have your nose swabbed to test for MRSA, a common bacteria that can colonize in the nose. If positive, you'll be given a prescription antibiotic ointment that you will place in your nose twice a day for 5 days. It is important to use the ointment to reduce the risk of bacterial infection in your new joint. You may choose to get your flu or pneumonia vaccine prior to your operation. Talk to your primary care provider for more information. After your surgery, you will need a walker to get into and around your home. You can get a prescription for a walker from your surgeon by calling the clinic. You may also need a toilet riser if your toilet is low, and a shower or bath chair. If needed, the hospital social worker can assist you in getting other medical equipment. If you are having a total knee replacement, place 8 regular-sized water bottles in the freezer. You'll be sent home with a Polar Care ice unit, and the water bottles will keep you from running out of regular ice cubes. Plan on participating in physical therapy, both with a therapist and on your own. Physical therapy is vital to your recovery after a total knee or hip replacement. When packing for the hospital, plan on being here for between 1 and 3 days, depending on your pain levels, response to physical therapy, and your insurance. Consider bringing a list of your current medications, walking shoes, a short robe and some loose-fitting clothing, toiletries, eyeglasses, a book or other stationary hobby, a list of phone numbers for your contacts, and your walker. Please do not bring your own medications, jewelry, or other valuables, or large amounts of cash. After your operation, you will wake up in the recovery room, typically on oxygen, with an IV and a large bandage over your hip or your knee. Once your vital signs are stable, you will then be transferred to a private room on the surgical unit. A nurse and a tech will be assigned to care for you. The nurse will monitor your surgical wound, vital signs, and pain levels. Some pain should be expected, but the goal is to reduce your pain to a tolerable level. Your nurse or tech will place TED hose on your legs each day you are here and show you how to care for them. TED hose help prevent blood clots, and you should plan to wear them for several weeks after your operation. Your nurse will also teach you how to use an incentive spirometer to help prevent post-operative pneumonia. After your surgery, you will meet with a physical therapist who will set goals for you to achieve by the time you're discharged, including walking with a walker, getting into and out of bed, going to the bathroom, and exercising to help gain range of motion, muscle control, and to reduce the risk of blood clots. Each day, you'll have 2 physical therapy sessions around 9 a.m. and 1 p.m. It is best to take pain medication prior to these sessions. Notify your nurse during the morning and afternoon medication pass. You will be taken to the inpatient rehabilitation gym to complete your therapy. There, you will work on stair negotiation and getting into and out of a bath chair in a bathtub, as well as other activities to get you ready for discharge. If you had a total hip replacement, you'll be taught any hip precautions you'll need to know. Your nurse will monitor your bandages while you're here and change them if necessary. Once discharged, you'll need to continue monitoring your bandages and change them if there is excessive bleeding or drainage. Bandages can be purchased at your pharmacy or at Walmart. Before you are discharged, a hospital social worker will discuss several post-operative options. Most commonly, you will have home health care for about 3 weeks, followed by outpatient therapy. Home health physical therapy is available if you are unable to travel to and from outpatient therapy. The social worker will discuss a stay in a skilled nursing facility as an option. And finally, the social worker will discuss durable medical equipment options with you. You'll want to get any prescriptions filled at your pharmacy on the day of your discharge, so they are available to you while you're at home. The sutures or staples will be removed about 2 to 3 weeks after your surgery. It is critical to keep your incision clean and dry. Do not immerse yourself in any water, such as a bath, swimming pool, or lake. Showering is okay if you cover your bandage with plastic wrap and seal with tape. However, a patient with a total hip replacement may not be able to shower until the bandage and sutures or staples are removed. Sponge baths are recommended if there is any risk of your bandage getting wet. Avoid wearing tight-fitting clothing over your incision. This can irritate the incision and it can restrict the movement of your new joint. You will continue using the incentive spirometer you were given by your nurse in the surgical room. Inhale 10 times each hour while you're awake. The therapy goals for your rehabilitation will be independent transfers in gait, advancing your home exercise program, and gaining the ability to straighten your knee and achieve 90 to 120 degrees of flexion. It is important to walk 5 to 10 minutes every couple of hours to help keep blood flowing and to help prevent blood clots. While recovering, it is important to avoid certain activities. Do not run or jump. Do not walk without a walker until advised to do so by your surgeon or your therapist. Do not rotate your leg. Do not put a pillow under your knee. Until your hip or knee is stable, you will also want to avoid uneven surfaces, low chairs, and chairs without arms, as these will increase your risk of tripping and falling. Your surgeon will let you know when you can drive again. Remember, you cannot drive before the surgeon releases you, and you cannot drive while taking prescription narcotic pain medication. After surgery, you'll be moving around less and may also be taking prescription pain medication. Both of these things can cause constipation. Taking stool softeners or Miralax daily can help prevent constipation. Increasing the amount of water you drink and the fiber in your diet will also help. If you experience chest pain or difficulty breathing, or feel calf pain, swelling, or heat in your leg, call 911 or go to the emergency room. If you feel severe or rapidly increasing pain, chills, or a fever greater than 101.5 degrees, or notice increasing drainage from your incision, or a marked change in redness or swelling of the incision area, call your physician. Do not hesitate to go to the emergency room or to call your physician if you have any concerns. There are a couple of things to remember after your total knee or total hip replacement. You will need to plan to use sunscreen that is SPF 30 or stronger on your incision scar, as it will be more sensitive to sunlight. Prior to visiting the dentist, you will need to call your surgeon to start on antibiotics to help prevent a rare infection. You will need to do this for the rest of your life.
The following exercise program should be performed each day prior to surgery to maximize range of motion, strength, and muscle coordination and contraction. You can do these exercises laying in the bed or sitting in a chair, whichever you feel most comfortable. Perform 20 repetitions of each exercise. Preparing yourself before a joint replacement will make these exercises easier after surgery. And the first exercise she's going to do is ankle pumps, and that is simply pumping her feet back and forth. Just do those 20 times, and that is it. Very easy. The second exercise is called the quad set, and Johnny is going to contract her quadricep muscle and push her leg down and get the back of her knee as flat to the bed as possible. She's going to hold that contraction for 5 seconds and then relax. It's not a big movement of her joint, it's just contracting the thigh muscle. Hold for 5 seconds and relax. The next exercise is called the hamstring set, and now she's just contracting the back of her thigh, the hamstring muscle. So she's going to dig her heel down and back like you're pulling off a boot. So digging her heel down and back into the bed. Hold 5 seconds and relax. Pull back and hold and relax. And she's just contracting this muscle back on the back of her thigh. The next exercise is the gluteal sets, and that's where she's simply going to squeeze her hips and make her butt muscles really tight. Tighten and hold 5 seconds and relax. Tighten and hold and relax. The next exercise is called the heel slides, and that's where she's simply going to bend her knee and slide her foot or her heel back toward her bottom and back. Just sliding it back and forth.
We're ready.
So the next exercise is a short arc quad. I'm going to use a bolster here to put under her knee. But what we usually do while you're here in the hospital is just fold a pillow in half and slide that under your knee. And she's going to keep her thigh and her knee down on the bolster and then just kick up so that her leg is straight. Hold that for 5 seconds. So kick up and hold 5 seconds and then lower down easy. Don't just let your heel flop back down to the bed. Use your muscle control up and then use it again to lower down easy. The next exercise is called a long arc quad, and that's the same thing but in a sitting position. She's just going to kick her leg up, hold 5 seconds, and then lower down easy. Kick up and hold, using that muscle control to lower down easy. The next one is laying back down. It's called the straight leg raise. And you can bend your opposite knee if you want to help take the pressure off your back, but just lift the right leg up and back down. This one you don't have to hold it up in the air for 5 seconds, that would be pretty hard. But just raise up to about the level of your other knee and then lower back down easy. Control that movement. The next exercise is a chair knee flexion. Johnny's going to sit on the edge of the bed or your chair. Slowly slide the foot underneath you as far as you can, and then hold it for 5 seconds, and then slide forward. Pull back under and hold 5 seconds, and then back to your starting position.
Thank you for watching the Total Joint Replacement online class. We look forward to being your partner for orthopedic health.